Hi and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and in this episode we're going to explore a little bit about autoimmunity and how that can cause hair loss in you. The theory of autoimmunity has many origins and many hypotheses. However, the predominant theory that's quite widely accepted is that our immune system, as we evolved from hunter-gatherers into living in urban environments, has less and less of a role to play in defending against viruses or bacteria or fungus as our hygiene improves. So the immune system sometimes goes awry and it attacks normal tissue. And in today's episode, we're going to explore what tissues can your own immune system attack that can result in hair disorders. The first thing that comes to mind, of course, would be an immune system disorder where your own immune system creates immunity against hair follicles. And that condition is called alopecia areata. It takes on many forms, including alopecia areata simplex, which is just a single patch of hair loss, and that has a 1 to 2% prevalence worldwide. So in this condition, white blood cells or lymphocytes start to aggregate around the base of the hair follicle, causing an immune damage to the hair follicle, resulting in hair breakage and hair shedding, and typically that area will be completely bald. A different variant to it will be alopecia areata multiforme, where multiple patches are appearing across the scalp synchronously or at the same time, and this will be a more severe form, which is sometimes cosmetically difficult to cover. The treatment for these two would be the same, would be to use a growth booster such as minoxidil, as well as to suppress the immune system in that area locally with corticosteroid injections or lotion. In most cases, even if you don't intervene, these conditions tend to resolve on their own. However, resolution can take between 3 to 6 to 9 months depending on the individual. Recurrent alopecia areata episodes sometimes warrant further investigation, such as sampling your blood for thyroid antibodies or vitamin D levels to see whether you are at a higher risk of recurrence of this condition. Alopecia areata also takes on a form where it involves the entire scalp, and that's called alopecia areata totalis. And in this condition, we no longer treat with corticosteroid injections, but there is a very popular new medication called JAK2 inhibitors that show great promise in growing back substantial amounts of that hair. And in a more extreme form, alopecia areata universalis can affect every hair follicle on your body, including your eyebrows, your facial hair, armpit hair, and other areas of hair-bearing skin. And that results in total baldness. And in such an extreme situation, certainly we'll want to find out if there were any underlying drivers for it, but JAK2 inhibitors has also shown great promise in regrowing hairs promptly. Now, autoimmunity does not always have to happen at the hair follicle site in order to cause hair loss. One of the main hormones that control hair growth and hair loss will be the thyroid hormone. So autoimmunity at the thyroid gland can also result in disruptions of normal thyroid function. And this disruption in your normal thyroid hormone levels, such as causing a drop in the overall thyroid hormone levels, thyroxine and triiodothyronine, can cause a hypothyroid episode, and hypothyroidism can lead to excessive shedding, diffuse thinning, even eyebrow loss. The treatment for this is usually done in a supportive manner, as Hashimoto's thyroiditis or the autoimmune condition associated with the thyroid gland usually is short-lived. However, if there's long-standing low thyroid levels, supplemental thyroid hormones can be taken orally. Another autoimmune disease that comes to mind is lupus, also known as SLE, not Seletar Expressway, but systemic lupus erythematosus can cause lupus hair, and this can involve cyclical shedding of the hairs, resulting in a lot of growth and then immediately a lot of shedding again, or even scarring type hair loss. Now, lupus is also a multi-organ autoimmune condition where it can affect joints, skin, kidney, and so on, and usually is managed by a rheumatologist. We've touched on the 3 common causes of autoimmune-related hair loss, but there are many more that we can delve into and explore in future episodes. Stay tuned to our channel for more hair loss-related content, If you like this video, share it with your friends, give us a like and subscribe to our channel so that you receive the latest updates and information on hair loss and hair restoration.